My name is Katie Jones. I'm a certified nurse practitioner, and I work in the wound care center as well as the neighborhoods at Brookview. So hyperbaric oxygen therapy is breathing in 100% oxygen in a pressurized environment. And so individuals will come into the wound center. They will come into the chamber, which is a clear, large plexiglass tube, essentially, and they are delivered 100% oxygen in that pressurized environment. We call these treatments dives, and that comes from like scuba diving, how you're at a greater depth when you are scuba diving, and so that's where that term comes from. So hyperbaric oxygen therapy works by having that oxygen, that very rich oxygen, 100% oxygen in a pressurized environment attaches to the blood cells, which are distributed all throughout your body, therefore also going to damage tissue and helping to improve the health of that tissue by decreasing inflammation, reducing bacterial load. Your body will actually start to produce small little blood vessels around those areas, so it improves your blood flow as well. Conditions that can be treated with HBO therapy range anywhere from diabetic foot ulcers to crush injuries, failed flaps, surgical wounds that have opened back up. We also can use it for radiation damage from radiation that patients will have for cancer treatments. Some of the late effects of radiation therapy depend on the area of the body that was affected. For individuals that maybe had it in their mouth or on their throat, will have some trouble swallowing. They might have difficulty with a dry mouth, have poor oral health, such as sores in their mouth or issues with their teeth. Individuals that have had it on their abdomen may have blood in their urine or in their stools. And it also can affect wound healing. Any area of the body that has had radiation is technically damaged. And so that area might be slower to heal if a wound develops there. If we are considering someone for HBO therapy, we will first bring them into the clinic and do what's called an HBO clearance. So they will meet with one of our medical providers, and we will do a comprehensive exam on them, going through their medical history, reviewing medications, and reviewing why we think that they are a good candidate. We talk to them about the risks and the benefits of the treatment, as well as what they can expect during those treatments. And then if we decide that they would benefit from that, then we run everything through their insurance and make sure that's all going to be covered, or let them know what that might look like from a cost standpoint. And then on the days that they're coming in for their treatments, they'll check in at the front desk, and then we bring them into the HBO suite. They will visit with the HBO tech, who will take their vital signs, check their blood sugar if they need that. We have a restroom in there, and they'll change into our clothing. They can't wear any of their own clothing in the chambers, and then the treatment will start. And that can range anywhere from about 2 to 2.5 hours, depending on what they are diving for. So typically, the HBO treatments are tolerated very well. Some individuals will experience some troubles with their ears, just a full sensation, especially when they are coming down to depth. And that will feel like it does when you're flying in an airplane or when you're driving in the mountains. And as soon as those ears pop, they feel normal. And our techs will help individuals get their ears to open up if they're having any trouble doing that. There is also some differences in air movement and airflow throughout the treatment, but for the most part, it's very, very well tolerated. And then individuals, they can watch TV, they can sleep, they can listen to music, they can really do pretty much about anything in the chambers. The only thing is you can't take a book in there, or you can't bring anything in with you, and that's for safety reasons. There certainly is the concern for individuals that do experience some claustrophobia, that they might not be able to tolerate being in the enclosed chamber. But the nice thing is the chambers are see-through, and we do have windows within the unit, so they can open the windows, and so you can see outside. The tech is always in the room with you too, and so that gives a sense of relief to people. But I would say for the most part, all of the patients that we have encountered with claustrophobia have done really well. It's just kind of getting through that first maybe 10 minutes or so of that first dive. So we find that the cumulative effects of hyperbaric oxygen therapy really give us the greatest results. And so that is coming 5 days a week for those treatments. We understand that that can't be feasible for everyone, especially if they have multiple appointments to go to. And so we do work around that. We have also found that even if somebody can get there 3 or 4 days a week, that's better than none. But we do know that the cumulative effect of those treatments is what offers the most benefit for treatment and healing. It's important to do HBO therapy with a medical professional because we follow strict safety guidelines as well as government regulations to ensure the safety and well-being of the patients that we care for. If you think HBO therapy might be right for you, you can certainly talk to your primary care provider, or you can call us at the Wound Center. And our phone number is 605-696-8068, and we would be happy to discuss that with you or schedule you for an appointment to talk about that further.